Greetings and welcome to the Pampering Myself podcast, an advocacy for self-care. We'll laugh, we'll cry, and most importantly, we'll learn that you can't pour from an empty cup. You'll hear stories, interviews, and conversations which will empower you in living your best life. Hello, and welcome to another episode of Pampering Myself. As I sit here looking out the window on this nice rainy day, I know the rain has been in my area here in Michigan. It has really rained for many days. My prayers go out to those families that have suffered losses because of the amount of water that has come into their homes. It has really been overwhelming. And to those individuals that are in the states where the temperatures have gone up to 130 degrees, it just seems like we go from one extreme to the next. But in any case, hopefully you all are safe. You're in a dry, cool place, and everything is going well with you. And that is my prayer. But today we're going to talk about the importance of oral hygiene. Now, if you thought dental care was all about what toothbrush to use, how often you should brush your teeth, and flossing for that perfect smile, then you just might be in for a surprise. In this episode titled, The Importance of Healthcare, I'll share with you what the medical community says about the connection between oral healthcare and your overall well-being. Now, when we think about medical conditions or healthcare issues such as heart disease or complications during pregnancy, pneumonia, or diabetes, how we manage our oral hygiene probably never entered our minds as a possible contributing factor. Yet it is. According to this article I read written by the Mayo Clinic, if you don't practice proper dental care, it could lead to not only cavities and gum disease, but it can also lead to a long list of other health issues throughout your body. Now think about it. Our body is the entry point to our digestive and respiratory tracts. But can you imagine the amount of bacteria that passes through our digestive and respiratory tracts every single day? Not only from the foods we eat, but from our environment. When we touch dirty surfaces, when we don't properly wash our hands, and then we put them in our mouth, or we transferring germs onto the foods that we handle and eat. So during this pandemic, it's been drilled into us the importance of hand washing and the transmission of germs. That's because the germs are picked up from anywhere and everywhere and enter our bodies, and most of the times through our mouth. But the research says that there's certain medications that can also contribute to poor dental health and by causing dry mouth, such as antihistamines, painkillers, diuretics, and antidepressants, just to name a few. It's a long list of things that can cause dry mouth. Now, according to the Dental Council, dry mouth increases your risk for tooth decay. It can also affect the soft tissues in your mouth, such as the gums, the lining, and the tongue. And my research also shows that people who use inhalers, those kind of inhalers where they have to breathe in, or those asthmatic machines for people who may have asthma, or people who have sleep apnea that put those machines over their mouths. These things can cause fungal infections and sometimes thrush. And thrush is an infection where you have those white spots in your mouth, and it is known to be painful. I personally have never had it, My daughter had thrush a couple of times when she was younger, from either putting stuff in her mouth, or we had guests from her pacifier. No, not pacifier. Although I used her nipple from the bottle as a pacifier, but she never had an official pacifier. But there's some good news about this whole thing, that our bodies are resilient. And we have a natural defense mechanism in keeping the bacteria under control, known as salvia. Now, salvia is important for 4 reasons. Number 1, it keeps our mouth moist and comfortable. And it keeps it comfortable and moist for reason number 2, because it helps us chew, taste, and swallow. Can you imagine if your mouth was dry? And I know you've probably experienced a dry mouth before from medications, or for whatever reason you may not have known that you had a dry mouth. But if you didn't have this salvia in your mouth, it would be very difficult to chew or to taste food or to even swallow. The third reason is it helps fight germs in our mouth, and it prevents bad breath. And the fourth reason why it's important is because it has proteins and minerals that protect our tooth enamel and prevents tooth decay and gum disease. So this salvia flow is really critical, and it's our body's natural response in keeping the bacteria under control. Now, on the flip side, there are certain medications that can affect our oral health, such as osteoporosis has been linked to periodontal bone and tooth loss. And that's according to the Mayo Clinic, because of the medications used to treat the osteoporosis. It carries a small risk of damage to the jaw bones. Now, so the bottom line is dental care is an essential part to our overall well-being. So I have 11 tips that I like to share with you in considering healthier dental care and overall care. Number 1, you should at least brush your teeth twice a day. That can be either in the morning or the evening before you went to bed, or in between meals. Number 2 is to use a toothbrush with soft bristles and a fluoride toothpaste. Now, I used to think, I guess, that the harder the tooth bristles were, the better, but they can scratch the enamel. So the recommendation is to use the soft bristles. Number 3 is either using a power toothbrush or a manual toothbrush. A power toothbrush is more highly recommended by a dentist, but you want to check with your dentist for whatever reason they may suggest one over the other. The fourth one is to hold your toothbrush at an angle to your gums and brush the outer and the inside surface of all the teeth. Number 5 is don't forget to clean the back sides of your teeth, tilt your brush, and make several small up and down strokes. Number 6 is to brush your teeth at least 2 minutes. That's what I like about my electric toothbrush, is it gives me a little signal each time I change one of the quadrants. Okay, so I brush at the top left, and then at the sign it tells me when it's okay to move over to the right, inside, out. Anyway, the whole process probably is timed for about 2 minutes, and that was what my dentist had recommended. Number 7 is to brush your tongue to get rid of any bacteria and bad breath. Now, a lot of times we don't even think about the tongue, but imagine all those little spots and things in your tongue, bacteria and germs just lay there. And if you don't brush your tongue, then that's where it sits. And that can a lot of times be the reason why someone has bad breath. Number 8, replace your toothbrush at least every 3 months. Now, this is one that I have to actually put on my calendar because I have electric and a manual toothbrush. When I'm in a hurry, I use the manual, although it's not really that long. But I forget sometimes to replace the toothbrush on both. So I have to put it on my calendar to replace the toothbrush. Number 9 is to floss between teeth every day. It is suggested that you not only do it every day, possibly twice a day or at least behind meals, especially if you have foods that might get caught up in your teeth, such as popcorn or certain meats or anything that might get stuck in between your tooth. And sometimes you don't even know it's there. So if you don't floss, you won't know it's there. Number 10 is to see a dentist every 6 months, because a lot of times we may have something that is hidden that we don't really know is going on, and they'll do dental checkups. And I know at my dentist office, I get a cancer screening test in the mouth. And although you might not know that it's important, it is. I actually know someone who had passed away from mouth cancer many years ago. And so I always go for that screening. And I think they may do it every 6 months. And the final one, number 11, as for mouthwash, my research indicates that there's good and bad reviews on the mouthwash. Some suggest that it may wash away some of the good bacteria. It may destroy the enamel on your teeth. So I'm not going to comment on the mouthwash. I would only suggest that you consult your dentist. And a lot of times they will make a recommendation on a toothpaste, mouthwash, and also a toothbrush. And I know my dentist office carries 2 types of toothbrush, although I could find it, or did find it, cheaper in the stores, department stores. I decided to go on their recommendation and buy the toothbrush from them. And of course, if there's one that they sell that they might sell in the store, then you might want to consider it, because I'm sure the mock-up in the dentist's office might be a little more. But in any case, we all want to make sure that we watch what we eat, we brush our teeth regularly, and we actually go to a dentist, because dental care is also just as important as anything else, and could be more so important because it could be the cause of a lot of other health issues that we may experience. So if you have young children, you want to start them out practicing good hygiene healthcare habits. And if not, wherever they are or wherever you are, you want to encourage that, not only for that beautiful smile, but to secure their teeth for a lifetime, and to also minimize the amount of other health issues that you could experience. As always, I hope you find this information beneficial. Please note, I am not a healthcare provider. This is purely information. Please do your own research and always consult with your own healthcare provider. Please feel free to pass this information along. And as always, remember to pamper yourself. Stay healthy. Thanks for listening.